Hey guys, my name is Dan, I'm a veterinarian, and welcome to the channel. Today we're talking about dental cleanings in the doggy or the kitty. We're gonna do a handful of things that are gonna make sure that we have a complete dental, and when you leave with your doggy or your kitty at like 5 p.m., you know that everything was perfect. So one, you should make sure that your veterinarian is going to do dental x-rays. Dental x-rays are an industry standard. It's a standard because, dude, when I first started practicing, guys, about 11, 12 years ago, we did not take x-rays. Even when I was working a corporate job, we would take an x-ray all the time. Now, my goodness, we are always taking x-rays. We x-ray every single tooth. And we have different standards to talk about, is a tooth viable? Should it be extracted? Should we do antibiotics to help the alveolar bone? Do we have too much recession of the bone? Like, we're gonna take x-rays because we need to make sure we have healthy teeth in there, just like your dentist will. So we will x-ray every single tooth, and it takes some serious time. And then the licensed technician or your veterinarian is going to take a hand scaler, or I should say an ultrasonic scaler, and they're going to scale. So the veterinarian or the technician will then scale the teeth, and they will scale. We have 4 different quadrants. We have 100s, 200s, 300s, 400s, and they'll scale everything. Once they're done scaling, very important, they will polish. They need to polish because when you scale a dog or kitty's teeth, you're making all these micro abrasions, guys. And micro abrasions will lead to calculus and tartar rebuild. Now, I have seen like cavities or dental caries in dogs before. They are not common. I do a lot of dentals. I've probably seen five over the last 10 plus years. I mostly get calculus, tartar, resorptive lesions, dead roots, abscesses, stuff like that. But the cool thing is, if you're able to scale and polish the teeth and produce a nice healthy tooth that has no recession or no damage to it, my goodness, that mouth can smell amazing, and you can restore the health and the appearance of the mouth to being years younger with a dog or a cat. So the veterinarian guys are going to clean everything up, and then they're going to come back and they're going to probe, and they are going to observe and evaluate the teeth and the gums, directly observing them as they do an exam of the mouth, and they're also going to compare that to the x-ray. If they find problem teeth, they're going to give you a call and say, hey, we should extract this tooth or we should do this. Usually, it's about extraction. Yes, you can do root canals, you can do different fillers. That's not common. Most veterinarians, when they find a bad tooth, they're going to drill it out, they're going to remove the disease, the pain, and solve the problem. If you want to go see a dentist, yes, they have veterinary dentists. Veterinarians like myself, I'm a general practitioner. I can literally solve like 99% of the problems. I can give you a healthy dog back. We may have 1 or 2 less teeth. If it's a Chihuahua, we may have significantly less teeth, but I can remove problems and give you a healthier doggy that's going to thrive. However, some people would like other options, and if you're one of those people, that is great. But you should be telling your veterinarian beforehand, say, hey, I don't want teeth removed if they are viable, if we have a chance to save them. So for example, if we have a broken canine, or if we have a broken carnassial tooth, they will recommend removing it, extracting it, because the pulp cavity can get infected. You can get infections into the blood, and you can get heart valve issues and kidney issues. And my goodness, guys, we can have a really, really sick doggy from a bad tooth, just like me and you. No joke. My wife had an infection in her mouth, and it swelled up, and it was intense, and antibiotics and an expensive root canal later, and she's all patched up. But just like humans, doggies, the most common area is get swelling under their eye, and guys, it can get gnarly. So we need to be removing broken teeth, bad teeth. If you want to go see a dentist, feel free to. But tell your veterinarian ahead of time, hey, I want to get things cleaned up. I want to make sure things are good and healthy. But before you pull teeth, let me know if there's an option to possibly save a tooth, because I may want to consult or refer to a veterinary dentist. And here in Omaha, we have one, and he's a nice guy. But most veterinarians like me, we're in there to solve the problem and give you a healthier kitty or doggy. All right, guys. So that's the plan. So here's the deal. We're going to look at the dog, do blood work, make sure we have a healthy pet, dog or cat, and then once we do that, we're going to roll into the dental. We're going to do a handful of things to the dental. Every veterinarian should, say it with me, take an x-ray, scale, polish, and then review the mouth and the x-ray to make sure you have a healthy animal. And then if we're going to pull teeth, they should be calling you to update you and front loading you so there's no surprises. I'm going to tell you this right now, guys. Incisors, these front teeth, they can be wobbly in small dogs. They can be like piano keys, and we may lose a lot of teeth sometimes. But if we retain the premolars and the molars, we're going to be just fine. I mean, my cat has no teeth, and she does fine. I promise you. Always consult your veterinarian regarding anything. Remember, dentals are incredibly healthy to a dog's or cat's lifestyle and health. After you, my last little soapbox here, after you get a dental done, after you get done, guys, please brush your dog's teeth. Brush your cat's teeth. Cat's a little harder. Brush your dog's teeth. If you could focus mostly on the tops and the outsides of the teeth, the buccal surfaces, that would be amazing. If you can brush every side of the tooth, that'd be amazing. But if you can brush that doggy's teeth better, it's going to reduce the amount of buildup, loose teeth, infected teeth, calculus, tartar in the future. Always use doggy toothpaste. Always use enzymatic toothpaste. I may have a link in the comment section. If I don't, go ahead and go talk to your veterinarian about some options. You can go on any of the online pharmacies, but make sure that it's an enzymatic toothpaste. Never use human toothpaste on dogs. All right, guys. Thanks so much for watching. My name is Dan. I'm a veterinarian. If this content is helpful, you should seriously subscribe and share this, because this channel should be much bigger, because I think I am pretty fun to hang out with. You guys take care. Bye.